Hello, everyone. Sorry for the delay. We had a slight technical issue. Good afternoon and welcome to our Lupus in Teenagers special virtual event in collaboration with GSK and us and Lupus. My name is Kelly and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you are unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect, to grow, and hopefully inspire each other throughout the peaks and the valleys of our lupus journey. And I say our because I have lived with systemic lupus since the age of 11. Now, we believe that every person living with lupus, no matter their age or their background, should be treated with equity, with dignity, and taken seriously. And it is our mission that patients feel heard, that they feel seen, and they feel valued. And if there are communities that are lacking in these areas, to come alongside and offer support. We chose to focus on lupus in teenagers today for a few reasons. If some of you have been following us since May, which was Lupus Awareness Month, you may have been aware that our focus was increasing health literacy throughout the month of May and how lupus affects younger populations. Our goal is to continue this plan of action by providing helpful and practical information today to inform and hopefully inspire. However, I would be remiss if I didn't mention that it goes even deeper than that for me. You know, as I mentioned, I was 11 years old when my lupus symptoms presented. And after being seen at a children's hospital, I was admitted for 6 weeks. What followed were multiple hospitalizations, with my longest hospitalization being 5 months. Many surgeries, shifting doctors, countless tests and needle pricks, interns sizing me up, and feelings of doubt, of uncertainty, and fear about my future. And this is all too common with children and teenagers living with lupus. The physical symptoms can be extreme, and the social and the emotional effects can be even more challenging to navigate. Now, after living with lupus for 30 years, I can say with certainty that those teenage years of my illness were the most difficult. In fact, I have something here and I'm going to read it. I have a journal entry I wrote when I was 15. I was telling Paula, my writing was sure a lot nicer back then than it is now. But it says this: it's funny when you're a child and when you imagine yourself growing older, going to high school, and getting married and living happily ever after. Then something happens that changes the world you thought you knew so well. Something happens and it changes the way you think and feel, and most of all, it changes your future. Then all of a sudden, there's complications and confusion, and that once clear picture of your life you had planned for yourself has been taken from you. And you're forced to live your life day by day, and all you can do is pray that you're not lost in the chaos. It's so hard seeing the difference between dreams and reality, and seeing the separation, the boundary, and being told that your dreams are all that they will ever be, just fantasies. Whatever you do, don't let anyone tell you what your future will consist of, and don't let anyone ever tell you your limitations. There is no boundary to life, creativity, imagination, or hope. Dreams can become goals, goals can become reality, and sometimes realities change, but whatever the goal, whatever the dream, know that life is full of endless opportunities. And if a door shuts, a window opens, whatever entrance you take, they all can lead to happiness if you want them to. And this is from Kelly Casas, age 15. And I can say with quite certainty that that is absolutely true. And I hope that anyone who's watching this right now shares this with anyone that you know that's a teenager, a child, or young adult living with lupus. So let's officially get started. Let me introduce our speaker for today, Paula White. Paula White is a registered nurse with 25 years of patient experience and is a patient engagement liaison for GSK Pharmaceuticals. Early in her career, she quickly discovered her passion to ensure patients are knowledgeable about their diagnosis and develop self-confidence in managing their disease. Thank you, Paula. I'm going to step off the scene here and let Paula take it away.
Thank you so much, Kelly. First and foremost, for sharing your story and being a beacon of light, having managed lupus yourself for 30 years, and letting teens know that you can be a beacon of light and there's nothing to hold you back, nothing to stop you in achieving your goals. So thank you for that. And thank you for having me as well. This is a time where discussion around teens living with lupus is so critical as we transition back into the school setting this fall. In these unprecedented times, it's stressful in and of itself, going back to school with a new year after a year dealing with COVID and being out of school and online. So very, very relevant topic today. So hopefully the information that we'll discuss over the next 15, 20 minutes will help you with that transition back into the school environment and then living the remainder of your teen years with lupus. So teen chronic illness impacts about 2 million children in the United States. And the symptoms of chronic illness within teens means they are lasting 3 months or longer. Lupus is one such chronic illness that does impact teenagers in the United States. About 6% of people aged 10 to 18 in the US do suffer from chronic illness. So understand you're not alone, but the population is fairly small. The importance of managing your chronic illness, as Kelly mentioned, pushing through is where it becomes very important as a teenager, and paying a particular level of attention to your illness and management of your illness. So as a child, about 15 to 20% of patients that do have lupus are diagnosed by the age of 16. So about 80% of lupus patients or lupus warriors, such as yourself, do fall in the female population. Childhood onset lupus is considered rare, but it is more common in children of African American descent, Hispanic, and Native American descent. So I just want to pause for a second and have you just think to yourselves, as Kelly so eloquently shared some of her story and her journal that she kept as a teen. I want to encourage you all, if you don't have a journal, if you haven't been journaling your story, begin to journal your story so that you will have that as a warrior to share with others in the future and become a beacon of light yourself for others in the future that you may be able to help that are beginning to deal with chronic lupus as teenagers. And I ask you, what is your journey? And again, if you haven't started that journey, write it down. When were you diagnosed? Talk about, your caregivers. Talk about those people in your life that you've shared your illness with. But please document that journey that you are going through. Lupus symptoms can impact your life with things such as rashes, hair loss. So obviously skin involvement is present. You may have pain in your joints and hands when you're writing or doing schoolwork and texting on the computer. There may be side effects that you could experience in relation to some of the medications that you have to take. Some of the medications can cause things like acne or weight gain. So the important thing is to remember Get a social support network. And teens and children are so resilient and empowered. Being here today, listening to this information related to teens and lupus, listening to Kelly's story should be help you feel empowered, if you will, to push forward and just recognize that you are dealing with a lot in your life. Again, returning to school, many changes that occur as a teenager. You're making new friends, maybe dealing with sports, starting new classes, developing physically, mentally. All of those things take a lot of strength, but realize that as a teenager dealing with chronic illness, such as you are, feel empowered. You are strong and you can manage your illness. The effects of skin can be present in areas such as, rashes in various areas of your body, perhaps on your face. You may have muscle or joint involvement that comes into play. Your kidneys are something to really think about. As a teen diagnosed with lupus, it's important that you pay attention to your urinary habits. The changes in the kidneys can be very subtle, but yet noticeable if you do pay attention, and make sure that if you notice any changes in your urinary habits, frequency changes, needing to get up at night, your urine looks different, those are symptoms that would be reported to your doctor as soon as you can. There could be some nervous system involvement. You might experience headaches. Blood involvement may be present, and lungs, maybe shortness of breath or involvement with your lungs as well. The impacts of being diagnosed at a young age, unfortunately, means that you're at greater risk for having more severe lupus. And teens being diagnosed with lupus, again, as Kelly mentioned, you will live with lupus as a chronic illness with no cure for a longer length of time in your lifetime. The kidney involvement for patients that are diagnosed at a young age can be as much as 50 to 75%, and that development and involvement can begin within 2 years after diagnosis. So that's why I mentioned the importance of paying attention to your urinary habits, something maybe you can write in your journal as well. Steroid usage, long term, the corticosteroids that you take to manage lupus flares, more than 90% of children that have lupus will receive corticosteroids in order to manage their disease. So you're not alone there. And the earlier diagnosis and the treatment and following treatment, we'll talk about a little bit, are so helpful in minimizing the risk of long-term organ damages due to inflammation caused by your lupus. The mental impacts of lupus can be great. So it's important to be proactive. And if you are dealing with any symptoms of anxiety or depression, you share these with your doctor. One of the health professionals that could be of value to be added to your team of caregivers is a therapist or a counselor. If you're feeling alone, isolated, looking for support, turning to family and friends. Maybe you have that one friend that you have shared your diagnosis with that you can turn to, or a family member that you are close to and can share your feelings with. Be sure, take your medicines as ordered. The treatments that the doctor has prescribed to you can hopefully help with some of this. And it's important to come up with a schedule or a routine for taking your medicines so that you're not missing any of your treatments. And that may be an addition to life right now as you're transitioning back to school and extracurricular activities if you're involved in those. Just come up with a routine and a schedule and reminders, if you will, so that you don't get off track with your treatments to hopefully keep your symptoms at bay as much as possible. If you are worried about going back to school, Another place where you could seek help would be within the school. There's typically a school nurse, and perhaps sharing your diagnosis and your journey with that school nurse would give you someone in that environment that would be able to be available to you if you need to step away and talk to them about your feelings, perhaps if you're at school and feel the need to reach out to someone. And again, importance of sharing your diagnosis with a friend or two that maybe you go to school with that could understand and be there for you as needed. So the healthcare team that is involved, I know I mentioned might want to add a counselor or something of that nature, but there's a lot of physicians involved in your care, and you and your support system need to help kind of quarterback that team and keep everyone involved in your care and what is going on when you attend each visit. Again, as Kelly mentioned, journaling can help. So you might have your primary care physician involved. You may have a rheumatologist involved handling your lupus. A nephrologist is the doctor that you would see to watch and monitor any kidney involvement that may be coming into play. As I mentioned, a counselor or therapist that could be on board. Your pharmacist, where you're going and picking up your medicines, may be helpful if you're getting your medicine at the local retail pharmacy. They may be a great resource of information as well as you're learning about your disease and the medications. And then nurses within your doctor's office are a very critical piece to your team. Sometimes it's easier to get in touch with them and speak with them if you need to reach out to your doctor's office at any time. And they may be able to help you engage in the school system as you're transitioning in, maybe communicate with your nurse within the school system, and also coordinate that healthcare team in conjunction with you and your caregiver. So it's important to stay proactive. Again, participating in an event like this, being involved with More Than Lupus organization and foundation, and meeting other warriors that are teens that are managing their lupus as well is definitely helpful. So I commend you for taking time to learn more about your illness. Read everything you can. I'll share with you at the end some information regarding a website where you can access and learn more information about lupus. Be honest with yourself and others, share your feelings, ask for help when you need it. Don't say yes to doing too much. Listen to your body, maintain a healthy lifestyle, and that means appropriate level of exercise and nutrition as well. Track your symptoms with your journal so that you know your good days, your bad days, and you write those down. So when you are coming back in contact with that healthcare team, you are able to give them a complete picture of what's been going on since they last saw you. Make sure to do that and be proactive. Bring it with you to your appointments as well. And I mentioned this before, but make sure that you're writing down your medications and your schedule of medications as reminders so that you can be aware, proactively share with your healthcare team that's on board any medications that may occur from one healthcare provider to another. And finally, very important is to avoid alcohol and drugs. Any recreational drugs and alcohol are not good for those fighting lupus, whether you're a teenager or an adult. But with that, it is so important to understand that the use of recreational drugs and alcohol can impact not only your symptoms of lupus, but they can impact the benefits or efficacy that you are receiving from the treatments that you are taking, those medications each day. So I pause again and just kind of ask you to think to yourself, how are you managing your lupus? Are you journaling? Are you sharing any concerns that you have or your journal with your doctor? How are you pulling in the importance of healthy nutrition? Are you avoiding any alcohol or any drugs that may present to you as a challenge? And who do you have to talk to about that? If not, find someone. Is there someone at school involving your friends in your care, a caregiver, parent, family member? For caregivers, I know we probably have some caregivers out there sitting beside a teenager or in place of a teenager, caring for a teenager with lupus. Things that you can do to help your teen manage lupus, the things I've mentioned, but help them stay on track. There's a lot going on right now. Again, as teenagers, there's a lot on their plate, a lot of different plates they're balancing. So help them stay on track with symptom management and medication treatment management, help with nutrition, help them document and make certain that they're getting enough sleep. Is there exercise involvement in their life? And sun safety is so important. We want to avoid the 10 o'clock to 4 o'clock hour. I know in some areas we get a lot more sun than others, but it's so important that you utilize, a good mineral-based sunscreen on a daily basis on your face and body, any areas that will be exposed on a routine, regular basis, and protect yourself or your skin from the sun, as that can set off symptoms of lupus. Work with your child to have a routine for their medications and the management of their disease as mentioned. And weigh in and pay attention to the teenager's emotional health. Do they seem sad? Are they withdrawing? So these are things, not only do I ask those of you that are teens to bring that information forward to those that are in your circle of care, but also I ask as caregivers of teens to be aware and proactively talk to them and ask questions and engage in conversations related to their chronic illness. And with that, I am going to share a last slide here with you that I was going to be able to share, I'm sorry, relation to tracking symptoms and getting more information and tips about your lupus and caregiver resources. So unfortunately, our technical difficulty was not going to allow me to be able to pull the QR codes up on the screen, but I want to guide each of you to seek more information in addition to what we've shared and talked about today. And that can be done through usinlupus.com. That's usinlupus.com. It is a website, again, where you can get tracking tips, applications that you can track your symptoms, learn more about lupus, learn tips to talk to others about lupus if you're working on trying to engage and communicate with those within the healthcare system, as well as school nurses or counselors. Gives you some tips on how to start that conversation and just everyday lifestyles and living with lupus. And then again, there's information there for anyone that may be listening that is a caregiver. There are resources there as well to help your teenager manage lupus. And again, that's at usinlupus.com. And I want to thank you, Kelly, for bringing again this so critical time for teenagers making transitions back into the school system, a talk and information to empower them to manage their lupus and learn everything they can to be their own beacon of light, as you did when you were managing lupus through your teens. Thank you.
That means so much, Paula. And I was sitting here, you couldn't see me, but I was nodding my head because of all the wonderful and practical advice that was just given. I encourage everyone to check out www.usinlupus.com. And we do have some questions that were actually pre-submitted. So I'm going to pull the first one up, Miss Paula. And this one says, which we kind of covered this already, I am a caregiver to a teenager living with lupus, and I'm concerned about the long-term effects that taking steroids may have on my child's growing body. Where can I go to find information on this?
So there are certain, thank you for the question. It's a great question because we think about treatments and like you said, the length of time that you may be on treatments, especially diagnosed as a teen with lupus, that there is great information out there that you can simply Google. But I encourage you first and foremost to speak with your doctor because the doctor is and should be your primary source of information that you would share any concerns about treatments that you are taking, if you're experiencing any side effects to those treatments, and if you are wondering, again, what some of the side effects to those treatments can be, because your doctor will be able to guide you in relation to what are the reasons, why the prescriptions that you have are being taken and the benefits in your management of illness, and bring clarity to the why behind each treatment that you're taking, not just corticosteroids to help manage your disease. So look to your doctor, but there are some great resources that you can refer to as well through maybe National Institute of Health and that type of thing. But your doctor can probably even print out some information. If you're a caregiver asking that question, it sounds like that you can utilize and turn to.
Absolutely. The next question that was pre-submitted says, I'm the mother to a teenager with lupus. I want to find support for my child and have her attend a support group, but I am scared she may hear someone's experience and get scared that that will happen to her. Should I send her or not?
Very good question. And I'm sure as a caregiver, a very common question and concern. I think definitely it's important that as teens, navigate the chronic illness of lupus, that they are involved in learning about their disease, that they meet other people so that they don't feel alone because although it's rare, right, to be a child with lupus, there are others out there, and working with organizations such as maybe More Than Lupus, the Lupus Foundation of America, you may be able to get your child in a more age appropriate group, but also it is important that you think about your specific scenario, your specific child and what age they are, and that you are cautious about the level of information being shared with them, because it needs to be a learning environment, right? Not a anxiety provoking environment. So I think it's very individual at what point you do bring your children to groups such as this, and really try to work with organizations to find an age fitting group that is right for your child, and maybe pre-screen that group, right? And let people be proactive and let people know that you will have your teenager on, and then monitor your teen or child to see what they are feeling with the information that they are hearing, that they're being exposed to in the support groups, and help them process that afterward based on their individual disease, and symptom management.
That is fantastic information, and I completely agree about the pre-screen. If my child we were considering sending them to a support group, that pre-screen process where you can go in and sit and ask questions of the facilitator and kind of get a feel for how the group dynamic is. That's really important. That's really good advice, Paula. The next question that's here, this is from a lupus patient, and he or she says, I am 15 and have lupus. I get sick when I'm in the sun too much. I struggle when I'm with my friends and they are outside because it is embarrassing to have to use an umbrella or to sit in the shade by myself. How can I talk to my friends about this?
Wow, that is a tough one. That is a tough question. It's a tough place to be in because you may be the only one in the group, right, that is worried about that. And activities, that you want to take part in, to feel that you have to hold back because you don't want to feel sick because you took part in an activity where others aren't having any symptoms or don't have a diagnosis of lupus. So I think first and foremost, again, talk to your friends, be open and honest with them. Is there one person in that group that maybe you've shared your story with? Sun safety. We talked about sun safety and putting on sunscreen, avoiding certain hours of the day. But it is important at the end of the day, maybe that 10 to 4 activity, or the activity with friends does fall between that 10 to 4, 10 a.m. to 4 p.m. hour, right? And it can put you at risk of becoming sick. But you have to share with them, be proactive, let your friend group know how sun impacts you. And it may lend to some great conversation about you and educating them about you and your illness. And it's interesting, but my experiences with chronic illnesses and children and teens is the support is vast if you just open up and share your concern.
Yes, yes. You know, we don't give children and teenagers much credit that they are incredibly smart, they're incredibly insightful, they pick up on things, and most likely they already know something's going on. Very in tune with people around them as well. And just being honest and just saying things that are very simple. I want to go to this party with you tomorrow, but if I sit in the sun today, I won't be able to. And it just that understanding of I have to do certain things so that I can spend more time with my friends later, or setting myself up for success so I know that I can be involved more or the way that I want to. And being just honest with our friends like that when we are a teenager really does help. There's one more question that came in that was pre-submitted, and it says, I am a parent to a teenager, almost young adult, with lupus. We are getting close to switching my daughter's care from pediatrics to adult care. I'm concerned that the doctor's views on things like dialysis may be different and confusing. Any suggestions?
Absolutely. And this is a transition, right? That we're all going to go through, that you're all going to go through. And being in that pediatric setting with your pediatric specialist, whether it be a pediatric rheumatologist, pediatric nephrologist, maybe a pediatric therapist, during that time of inevitable transition, I think it's so important, again, to be proactive in sharing that concern with your pediatric specialist and getting tips and advice as to, who maybe the best adult specialist is for your teen, and meeting with that specialist, sharing with maybe the nurse in the office any concerns that you have with that transition, and knowing, being proactive and just aware that this transition is going to happen, and what is that new environment going to look like for your teen, going from a lobby, right, in a waiting room where it's primarily teenagers or children, to a lobby or waiting room where it's full of adults, young adults, older adults, middle-aged adults, and then some will be elderly. So I think, again, it's a situation where you need to coordinate care, right, from those pediatric specialists to the adult specialists. Be proactive in conversations about what that transition is going to look like. And there are also some tips on the Us and Lupus website in relation to caregivers and transitioning your care with your physicians for teenagers.
Fantastic. Once again, it comes down to kind of being proactive and anticipating the changes around the bend and being informed. I love those suggestions so much. And we've had some comments come in. Estella Mata from Blooms for Lupus is here joining us. And she said, yes, journaling helps not only to track your symptoms, but also to write down how you're feeling emotionally. She was agreeing with your suggestion there. Estella also said, connecting with others that are going through similar situations can be helpful to you and also to them.
Mm-hmm.
And communicating with your provider is also so important when it comes to treatments. We have Robin joining from Chicago. She says, great information. Estella is commenting that it's also important to remember that children also know that every case with lupus is different with everyone. That's a great tip, Estella. And that's something too when it comes to joining a support group, is reminding your teenager that every lupus patient is a little bit different. And just because one person in the group may have nephritis or blood involvement doesn't mean that necessarily would happen to you. I think that's really important. Estella said pre-screen process is great advice. Robin is concurring. Pre-screen is a wonderful idea, even for adults. Yes. Let's see. Estella says, sharing to your friends about how the sun makes you feel, that may help them perhaps help you. Yes. And Robin hits the nail on the head. Teens and kids can be more supportive than adults. They can just something more often than not.
Yep.
Very true. I can't tell you, my son has asked me more times, how are you feeling, Mom? How are you doing today, Mom? Than most adults do. So we love our young lupus warriors here. And we are so thankful to you, Paula, for the time that you took today to just delve deeper into allowing those to understand and help the teenagers with lupus in their lives, whether they are a mother, father, friend, caregiver, or whether you're watching today and you are indeed a child or teenager or young adult with lupus. We hope you found this information helpful, and that if you need any further assistance or have any further questions, Us and Lupus is the place to go.
Thank you so much, Kelly, for having me again.
Wonderful. Well, that concludes today's virtual event. Please check out morethanlupus.com for more information always on the latest lupus news, events, and really allowing people to amplify the patient voice and fill the needs in the patient community. Thanks again. See you next time. Bye-bye.
Bye-bye.